now is Bernard Adams. He is an advisor in strategic marketing with Priority Health. Bernard, thank you for being with us today.
Thank you much, Tyler. How are you doing today?
Doing well. How are you, Bernard?
Hey, I'm doing great.
Good to hear. So let's start off by telling us a little bit about your background and how you ended up with Priority Health.
So my background has been in healthcare for over 25 years. I've served in roles where I've done pharmaceutical sales. I've worked with healthcare plans, and I've also worked with agencies where I've done advertising for insurance companies, hospitals, and things of that nature. And that's been a good course of my career.
And so when did you first get involved with Priority Health, and what are some of the ways in which Priority Health is different than other places in the healthcare industry that you've been before?
So I started with Priority Health back in 1996, and at that particular time we were regional. We were in the Grand Rapids area, and then from there, we looked to expand to, as we are now, all over the state of Michigan. And that's one of the roles that I serve, is to introduce, Priority Health to the southeast side of the state. And, whether it's in Wayne County, Oakland County, I will be working in all the counties to introduce our brand. And even though we've been working in the area for a really long time, I'm just going to bring it more in a grassroots standpoint. And you think in terms of like what sets Priority Health apart. Priority Health, like I say, it's not only on this side of the state, but it's on the southeast side. But, we've had, recently we've come together with Beaumont Hospital, and that was as of February 1st of 2022. And so that's creating a new healthcare system between Priority Health and the Beaumont Health System. And that's going to be designed to really, improve healthcare, health equality, enhance consumer experience. We want to improve the care quality, as well as the values and outcomes as part of what sets Priority Health from other plans.
And then can you tell us about Priority Health and its partnership now, Total Healthcare Foundation, and what was the impetus behind Priority Health ultimately getting involved with this organization to provide healthcare to a number of different people in certain populations in Michigan?
So with Priority Health and Total Healthcare, so it began as a partnership. So the partnership, you think, between Priority Health and Total Healthcare, so is, once again, it's designed, to improve the well-being, for the people of Detroit. So we want to invest in organizations that are dedicated, to the needs of the community. One of the most recent ones that we've done was with Brilliant Detroit. And as you know, they have approximately 12 homes that's around the city of Detroit. And with that, they help out moms that are pregnant, things of that nature, might help them with breastfeeding or people to read. And so through the Healthcare Foundation, there was a $148,000 grant, that was provided to help Brilliant Detroit. And this is just one of many organizations that we partner with grants to help, really the well-being of people in the city of Detroit.
We're joined by Bernard Adams. He is an advisor in strategic marketing with Priority Health, joining us on the Oakland County MegaCast. What sort of services in healthcare can be provided to individuals through the Total Healthcare Foundation in partnership with Priority Health?
So there are many different services that can be provided, but to give you some of the, just a couple of them, one of them is called, Centering Pregnancy. And basically what this is a unique group just for prenatal care, but it offers special support and friendship, for pregnant women. These are people they have people that they can talk to at any time. But there's also a behavioral health hotline that they can call. And with this here, so Priority Health has staff, and it's 24/7. And so this can be reached through telephone, and it's really on the back of member ID cards. So if there are any questions that people have, if there's something that they're going through, this is another resource that's there for the members. But you also think in terms of, we have a virtual care. And so the virtual care is great also because it's the same copay as if you were going to see your doctor. But with this here, you don't have to travel anywhere. You can do it in the comfort of your home, in your living room, and you can still get that same behavioral health care, over the phone that you would do as you go into our office.
We're joined by Bernard Adams, advisor in strategic marketing with Priority Health, joining us on the Oakland County MegaCast. And so before the before the partnership with the Total Healthcare Foundation, where do these individuals that are tapping into this resource and are being helped by this healthcare resource in partnership with Priority Health, where did they go for these services before?
There are different agencies that people were going to. I don't have the specific names of where people were going to, but you think in terms of even with Total Healthcare Foundation, that we have. We do have, a website that people can go into to also apply for a grant and things of that nature, which would be beneficial. But it's the same that they can do with other agencies. But with this here, with the Total Healthcare Foundation, like I say, this is more geared to the well-being for the people of Detroit. So we want to, invest in organizations, that are dedicated to meeting the needs of the community. And just for that, I will give, the information as far as for our healthcare foundation. That way, if someone wants to apply or get more information, they can go to it. So I'm going to give that. The email is thcffoundation@thcmi.com. And I'll repeat that one more time. thcfoundation@thcmi.com.
We're joined by Bernard Adams, Advisor in Strategic Marketing with Priority Health, joining us on the Oakland County Megacast. Again, the email for more information is thcfoundation@thcmi.com. That's thcfoundation@thcmi.com. How has the COVID-19 pandemic played into factored into the ability for people to receive quality healthcare, particularly in high-need areas where healthcare is often or can often be a hard asset to come by?
Yeah, it's come to be, one of those things where people would normally be able to go in and visit their physician, schedule an appointment, and go in. But it's also created the opportunity for healthcare plans to be more creative with their members on still providing that healthcare. So you think in terms of versus someone being able to go see their physician and now not being able to go in as often, it's opened the door for the whole virtual piece for them to be able to still receive that health care. And that's become a much more seamless process where they can still speak with the physician over the phone and they can still do prescriptions or anything that might be needed. So really it's kind of seamless now, even though initially when COVID first came about, it's like, okay, how do we go about doing this? But the virtual has been a very good success for that.
We're joined by Bernard Adams, Advisor in Strategic Marketing with Priority Health, joining us on the Oakland County Megacast. Again, the email for contacting Priority Health and the Total Healthcare Foundation is thcfoundation@thcmi.com, thcfoundation@thcmi.com. Just how many people, give us a look at the scale of just how many people have been helped by this partnership with the Total Healthcare Foundation to be provided healthcare and other health-related services that they may not have had access to otherwise if this partnership weren't in place.
So if you think with the Total Healthcare Foundation, this was formed in 2020. So between the merger between Total Healthcare Foundation, or the Total Healthcare and Priority Health, there have been many recipients. So not only Brilliant Detroit, so there's been the Brightmoor Connection Food Pantry, the March of Dimes, the Sanctum House, St. Vincent de Paul Society, and several others, that have been recipients of this with the foundation. So it's affected many people. And with this here, so it's been over $4 million that's been spent down. And with that, it's one of those things, like I say, when people apply, there's a quarterly meeting that the foundation board come together and they're able to review any grants that come in. And then from there, the decision is made as far as any recipients. And then from there, anything is dispersed. So there could be even additional organizations that could be added to this list, and many have been added.
If your organization is interested in these services and being added, and would like to inquire, thcfoundation@thcmi.com is the email, thcfoundation@thcmi.com. We're joined by Bernard Adams, Advisor in Strategic Marketing with Priority Health on the Oakland County Megacast. Bernard, a couple more minutes with you before we'll say goodbye today. Anything else at this time that we haven't touched on today, or any other topics related to Priority Health or to Total Healthcare and Total Healthcare Foundation that would be important for our audience to know, or things that we should be keeping a lookout for in the near future?
Yeah, there are many different aspects that come along with Priority Health. So not only so we have individual plans, we have small business plans for small business owners, but we also work well within and do a lot within the Medicaid and Medicare population. And you think back in terms of with some of the pregnant mothers, another thing that we do have is what's called the Maternal Infant Health Program, or MIHP for short. And so this is free for Priority Health Medicaid members. And so it provides regular in-home visits, by a nurse, a nutritionist, or a community health worker. And also along with this MIHP, some of the services that are included with this, there's free transportation to doctor appointments, WIC, childbirth, parent education classes. Like I said, there's in-home nurse visits. There's help getting prenatal care. And there's also a lot of questions that are answered, anything dealing with pregnancy or caring for your baby, as well as, there's help with any health problems that could affect your pregnancy with this maternal infant health care program, also through Priority Health.
Bernard, thank you so much for joining us.
You are very welcome. Thank you very much.